We present an advantage and the advantage of ovariohysterectomy in dogs. Introduction and ovariohysterectomy OVH or SP is the complete removal of the female reproductive tract, the ovaries, oviductus, uterine horse, and the uterus are removed. Not only does the procedure prevent the animal from uh, becoming pregnant, it also eliminates the taoids yearly it cycles. OBH is one of the most frequently used surgical procedures in the case of companion animals. Is the recommended by many animals welfare organizations to control dog populations. And is recognized by World Health Organization. This surgical procedure must be performed by veterinarian use general anesthesia. There are two ways to approach OVH in the female dogs through the medial and the lateral line. The latter is the most would use approach in Colombia. Advantage in general, OVH can be less um, procedure as major incisions is made in the present, which means there is less risk of infections, such as breakdown, pain, or post-operative complication. Recovery team can also be faster when performed by a skilled surgeon. Ovarectomies can also the quicker, meaning the patient is anesthetized for less time, which is safer for your pet and cheaper. It prevents is bitch for becoming pregnant for the rest of the life, decreasing kind overpopulation. Second, we removed the ovaries, the genders. We avoid the payment of diseases that could arise in the organs. Third, if it is carried out when the bitch is young, the changes of the appearance of breast tumors are considerable reduced. Fourth, unwanted mating can be avoided.
Okay. And the complication in the country, ovariohysterectomy is the most frequently used method to control dog populations, but it causes diverging signs the brains of the circle in a branch. A clinic is the more legs in the equivalent 20 days of legal meals and wage and the difficult task for the public to ask of the tip the protein mesh and in the complication in the person and the and the ovariohysterectomy is hemorrhage and ovarian remnant syndrome, strampiometry. And the complication and the principles on three. And the first is the hemorrhage. Um, the hemorrhage has been described by some authors of the most complication associated with the ovariohysterectomy, with uh, 79% the incident in intraoperative hemorrhage, and uh, it is the some study the rate hemorrhage was only 2% in 29 dogs. Surgical, the large body signs and intra-abdominals cause a significant increment in the risk of this complication. The second is ovarian remnant syndrome. Um, ovarian uh, ovarian geometry of ovarian remnant syndrome is a rare complication of ovariohysterectomy in dogs and cats. Residual ovarian tissue most commonly result from the incomplete resection of the ovarian uh, during the surgical, and one experimental study showed the fragment of ovarian tissue and can because uh, revascularize the of the mesentery of other uh, oment is, and the complication is attributed in the surgical and error. And three is stamp pyometry. Pyometry is the result of the incomplete resuscitation of the uterine in the body, the cats and dog. Um, is fact a number large studies performed in Europe have demonstrated ovariohysterectomy only prevent the large occurrence of pyometra is with cool and efficacious in a complete the ovariohysterectomy. Okay, the conclusion is there is great and the characteristics and complication in family, the dog and the ovariohysterectomy, and the most necessary uh, to investigation more studies with our complete information of the surgical and post-surgical the complication of the ovariohysterectomy, um, ovarium's complication are who is the considered the best option of the avoid reproduction and hormonal problems in dogs and cats.